Hi, I'm Brittany.
Hi, I'm Carol, and welcome to me and Brittany's COVID-19 and Mental Health Journal article.
Our learning outcomes for today are to describe mental health stress symptoms in COVID-19 patients, evaluate the limitations on a study investigating the mental health effects from a physical illness in the midst of a pandemic, and justify the benefits of studying the effects of a pandemic on mental health, such as an internet-based intervention in an isolation ward. The original panic around the SARS-CoV-2 pandemic, which started in December 2019, seems to have subsided. For example, there's toilet paper back on the grocery store shelves. And now, secondary effects such as mental health stressors are becoming much more apparent. As of right now, research is quite limited on these secondary effects, as priority has been given to research looking at the modes of transmission as well as vaccine research. However, it seems that there are several factors that are contributing to these mental health stressors for COVID-19 patients, such as isolation and feelings of loneliness, and these symptoms are manifesting themselves in different ways. Common stress symptoms for COVID-19 patients include high stress, depression, anxiety, insomnia, nightmares, and poor concentration, just to name a few.
Our journal featured a study that tested the efficacy of this internet-based integrated intervention on depression and anxiety symptoms in patients with COVID-19. This study was the first of its kind. Back in February, Shenzhen University in Hangzhou, China, wanted to see how well this internet intervention program worked in decreasing depression and anxiety in in-unit patients on the isolation COVID-19 ward. This intervention that they created focused on relaxation, self-care, and raising a sense of security. Our study is testing how well it worked.
This was a randomized, controlled 2-week study, and the participants were patients in the hospital isolation ward who were confirmed to have COVID-19. The participants of this study were split into two groups: the control group, which received only supportive care, and the intervention group, which received supportive care and the internet-based intervention with daily tasks. Throughout the study, their depression and anxiety levels were measured using these two standardized scales, and the intervention group performed daily tasks such as breathing or relaxation training, mindfulness, refuge skills, and the butterfly hug method. As seen by their graph, there is no statistically significant difference between the intervention and control group at the beginning of the study for depression and anxiety levels. However, by week 1, there is already a significant difference between the control and intervention group for depression and anxiety, and this difference is even greater by week 2 for both depression and anxiety. This is really exciting because this shows that their internet intervention significantly reduced anxiety and depression in COVID-19 patients in isolation.
In conclusion, the intervention worked. There are some limitations though. The sample size was small, with only about 20 patients being studied. There was bias because it wasn't a blind study, and it was short, it only took 2 weeks. Brittany and I wondered if some of the successful effects or results of this study had to do with the confounding effects of having daily tasks. So imagine this, you're in the hospital ward, you're alone because it's isolation, and you're sick, and the only thing you can think about is, I hope I get better. But if you give someone daily tasks, perhaps it helps them feel empowered. I'm taking part in my getting better today, even if it has to do with my mental health. That aside, this study, I think, is more helpful than just studying this one intervention but it really opens up the avenue for future studies in this area. We think that it would be really awesome if these people started, or other people, other researchers, looked into creating similar interventions but for the entire population. Those affected by quarantine, sometimes it leaks into home life, the isolation and the stress of school and work at home, and small businesses being shut down. Thank you for coming to our presentation of this paper, and we hope you look into it and look into future studies that are similar. Have a great day, guys. This presentation was brought to you by this wonderful article, and here you can go check it out at the link. Thanks for coming, guys, and have a great day.